So I want to begin this week and talk about something really important. And a lot of people may wonder, why do we care about this concept LOM, which is level of measurement? So if somebody says, what's the LOM of your variable? This way you'll know. But the real importance is that every statistical test that we talk about, so any kind of hypothesis testing, t-testing, regression, if we're doing an odds ratio, we need to know the basic rationale, or the basic a given would be, what's your variable's level of measurement? So I'll go through and I'll give you a bunch of examples, but it's mostly informational so we can get a sense of what these LOMs, or level of measurement, really mean and why it's important. So let's begin. Sorry, my computer wants to freeze now. You all know what a variable is, right? A variable is simply something that has different responses. If the responses are 100% the same, there's no variation, therefore no variable. So intelligence, right? If people believe intelligence is measurable, it could be an IQ score. Height could be in kilometers, or it could be in feet. Gender could be in categories. Test scores, like what did you get on the exam? I had a 40 out of 50, right? Quality of life, you could say, right? Poor, average, good, excellent, those kind of things, right? Excellent, very good, good, fair, poor. Educational attainment, it could be graduate school, it could be college, it could be high school, associate's degree, high school, grammar school, et cetera, et cetera. Type of treatment. Were you in the group that received the control, or did you get the control as a placebo, or did you get the real kind of medication? And group assignment, like what group are you in? Whatever group could be, and it would be a name. I'm in the control group, I'm in the experimental group, right? These are all variables. And just think of it this way: a variable is a way of taking a concept, defining it, and making response categories for it. So we measure variables. Again, that's my kind of plea to you all, that we have to understand the level of measurement, because it kind of tells us what we can do with it, right? So is it a nominal level variable? Is it ordinal? Is it interval ratio? And then what kind of testing can we do to figure out the relationship between these variables? Again, here's the example, right? There are four, and I'll tell you that in most sciences, we collapse interval and ratio. So these two get collapsed into one, or hyphenated. So nominal, ordinal, interval, ratio. And again, depending on the category, it lets us know what tests we can use. So for example, if you say I'm studying education, or the research article I'm looking at talks about education, how does it capture it? Does it ask number of years of school completed? Does it ask them have you completed high school? Yes, no. Does it ask you by the type of school, grammar school, high school, college, grad school? All of these questions capture education, but each of them is a different level of measurement. And as we go through the categories, I'll show you. Right? Again, we need to know so we can do the math. Each level of measurement, if we think about it like a table, they each have their corresponding level of central tendency and level of dispersion or variation. So they all have certain tests that we can do, and certain mathematical or statistical properties that we really employ. Nominal are the basic category of measurement, and you can't do a lot with them, but sometimes it's all we can ask, right? So if we say, can you please tell me your political party, and the people outline their political party, we can't rank it. There's no better or worse, right? There's no judgment value. They're just different names. So nominal is for name or label. If we say, what day of the week is it? There's no value to the different days of the week. They're just a name. If we say, we used to use things like, if we say, I don't know, what neighborhood or community do you live in? And people write in a name of a city or town, it's just a name. So these are variables. We used to use things like gender. We used to use things like race, right? Those kind of things, or ethnicity. Although these types of variables now are much more to unpack, because gender or race, while they're nominal variables, they also bring in a history of a lot of other concepts. So they're one simple term, but they tend to kind of over homogenize, and we'll talk about it, but sometimes reify or make ideas that we construct more solid. But anything that's just a name, right? We can't say, if we go using census data and we look at race, we can't make any ranking, we can't make any relationship other than they're just named categories. With gender categories, we can't make any name or relationship. We just say, how do you identify? And if we use traditional categories, from the past, male or female for sex, man or woman for gender, they're just different labels or names. And if you ask someone like, have you attended high school? Have you completed the survey? Have you attended the orientation for our study? Those questions, while they're yes, no, they're nominal, because we can't rank them. They're just yes, no questions that matter. And what we can do with the operations of these variables, it's pretty limited. So we can tell you that in our sample, 80% of people identified as being a woman. So 80% identified as being a woman, 20% identified as being men. So we can't do much with it. We can give you the count, we can give you the number, we can say there are more women in the sample than men, but we can't do really much math. And here you see, we can display it, and people love visual depiction of data. So we can show this relationship, right? What percentage are independent, Republican, and Democrat? And this visual representation data is great, because you can see in this pie chart that the largest piece of the pie in this group is the Democratic Party affiliation. So it's a quick snapshot of seeing the data like kind of live visually. Ordinal, if you think of ordinal is ranking, and ranking is, think of freshman, sophomore, junior, senior. It's the quickest one that we do. If you think about excellent, very good, good, fair, poor, those are ranked items. If you say, think of pain level, would you say your pain is mild, moderate, or severe? These are words, but they can be ranked, because we know that somebody who says that their pain level is high is experiencing more pain than somebody who says their pain level is low. We don't know how much more pain, but we know when we rank them or put them in order, people saying they experience low levels of pain are at the lower end, and people who experience high or higher up. So we can talk about that, like pain rating, or we can say people who, we ask people, please, tell me how you would rate your overall health. Would you say it's excellent, very good, good, fair, poor? We know that the people who say poor have a worse condition of health than those that say excellent. So we can do relationships amongst the variables and compare them, but we can't compare them mathematically. Again, we can just say, 50% of our sample says their health is good, and only 10% say their health is poor. We can compare, but we can't do any mathematical equations or relationships or testing. And ordinal, you can see here too, we still use the same pie chart, and you're going to see a visual representation. So it is true that self-rated health is a really good risk of predicting mortality. So mortality, right, is just risk of death, and that we use a 5-point Likert scale. I say Likert, people say Likert. And then we ask the individuals, please rate your health. Would you say your health is poor, fair, good, very good, excellent? And you can see from this chart very quickly that the majority of people, 45%, said that their health was good. And this is a phenomenon that we see a lot it's ubiquitous in the United States, where people always up their health rating. So people will always say, oh, my health is good, right? My health is good. So, you know, for the people who rated their health as fair and poor, these groups are groups that you'd want to investigate or you want to talk to more about really what's going on with their health. We really link this to mortality and to health outcomes, because when you ask somebody to rate their health, they're bringing in a number of ways of thinking about it. So their physical health, their psychological health, their functional ability, right? All those things and many other things come packaged in one score. So this score is really, really powerful. Again, but it's ordinal, right? We can say that, you know, I mean, if you look 4 times as many people say that their health is that their health is good compared to poor, right? But we can't do much else with this category. It's relational. Interval ratio, this is how they look when they're 2 separate entities. So interval has a 0 point, but it's arbitrary. So it's like you create a scale like Celsius or a Fahrenheit, and then you give values to the scale. And it's the reason we don't use it that much in the way that we do research. Ratio is really a true 0. So a 0 would mean like 0 weight, 0 distance, 0 height. And these have more applicable values. But for this, I wouldn't worry. I would just think that interval ratio, when we put them together, and I'll show you in the next slide right here, that these are the highest level of measurement. So I always say if people use like cars or whatever you think is valuable, platinum, or maybe a Mercedes, I don't know what's a fancy car, Tesla, I don't know. But this is like the highest level, right? Or maybe the gold standard of measurement. This level of measurement, interval ratio, allows you to compare cases, to count cases, to do math, to do all sorts of things, because these are quote unquote real numbers, right? So interval ratio is the highest level of measurement. When you're doing data collection or you're doing testing, we tend to push for a high level of measurement. So we have a lot more options when we choose our statistical tests, right? So higher level of measurement, it's better for statistical testing if you can measure a variable that way, right? You can't measure political party affiliation using interval ratio level data, but we can measure education. So instead of saying, did you complete high school, which would be yes, no, would be nominal, we could say, have you completed grammar school, high school, associate's degree, 4-year college, graduate school? That would be interval ratio. And then if we want to go for the highest interval ratio level, that would be ordinal. If you want to do interval ratio, you would say, please tell me the number of years of education you've completed. And if somebody says, I've completed 24, and somebody else said, I've completed, 6, the person who's done 24 years of education has done 4 times as many as the person who's done 6. So we can do math. These are numbers that are operational for mathematical equations and manipulation. And right, we can do it all. So this is the right gold standard. This is whatever you believe is the highest pinnacle of something, and that we can do it all. We could do graphs, we can do hypothesis testing, we can do all sorts of levels of measurement. Now, it doesn't mean if you don't have interval ratio, you can't do those tests, but you have to look at the test and say, okay, like an instruction manual, right? This test requires that at least one variable is interval ratio. Okay, I have that. Or this test requires that all variables are ordinal level of measurement. Okay, I meet that requirement. So it's just matching those up. And then we code a lot, right? So when we talk about level of measurement, the way that we really get it is we look at these. And let's see if I can annotate for you. I'm gonna let's do like, oh, sorry, that's like a bad. Let me undo that. Let's see. I'm gonna see if I could just, let's see, put it here, and let's do this. think I'm gonna just maybe do this. I'll stamp. Right? That if we look at this, these are the levels of measurement. These are the responses which determine level of measurement. So what type of interview, right, will you conduct? And so we're coding it. So you might want to say face-to-face, by phone, or virtual, Zoom, or WebEx, right? How did you interview the client? How did you conduct your research? So these are nominal. They don't have any value. We can't rank them and say, well, doing a face-to-face interview is better than by phone or by Zoom. We don't know. So we know this is nominal, right? From the responses, we know the level of measurement. A dichotomous variable, if we would say, have you completed the interview? And the responses are yes, no, that's also nominal, right? Is the person in the control group? Yes, no. That level of yes, no, it's a nominal level variable. So coding is looking at the variable that you ask, the question that you ask on a survey, which is a variable, and then taking those responses and looking at it and saying, what's the level of measurement? And it'll become clear as we do more of these. Now, we've talked this semester quite a bit, but as we get into levels of measurement and types of variables, it's really important that we're clear on which is your independent and which is your dependent variable, and how they can be used when we do hypothesis testing. And these are really important for causality. So we need to know which variable came first and how are we setting up the study. All right. And we'll talk about the dependent, DV, IV. When I came up through research methods, the dependent variable was the Y and the independent was the X, right? X led to Y. So however you see it, independent and dependent variable, we need to define them. We call it operationalization or conceptualization. So if you have something like height or weight, we know we can say, okay, we can do BMI, or we can do inches, or we can do, feet and inches. But other concepts like pain, anxiety, stress, depression, those concepts are super broad, right? And if I asked each of you to define them, you might come up with different terminology. So what we really need to do is think about, how are we going to define them? What scales, what measures are we going to use? And I'll give you some examples as we go through the slides, but there's so many measures for depression. Think about your fields of study. Are there functional independence measures? What other measures or scales or ratings do you use with your clients? And do you have options? Do you have memory screening tests? We have many of them. Which do you use and why? So it's, how do you operationalize like cognitive ability or depression, or attitudes about COVID, right? That's a huge question. You operationalize it by how you define the concept and how you make questions about it. So I'm giving you an example, and then we're going to go to the study. So here, of course, right, I deal with older adults, and this is the Centers for Medicare and Medicaid. They have operationalized quality indicators. Now, many of us, when we worked in hospital settings, we lived our lives around quality improvement measures and quality indicators. So take a minute or two, and you see that there's pressure ulcers, weight loss, falls, depression, depressive symptoms, antipsychotic medication use, and pain. So you might say, well, high pressure ulcer risk to me would be anyone having a pressure ulcer. But the definition here is someone getting an ulcer within the last 7 days. So somebody who had an ulcer on day 8 wouldn't count. Weight loss, you might say it's any pound of weight loss by a resident. But here, percentage of residents who lose 5% of body weight in the last 30 days, or 10% in 6 months. Falls with injury, right? Oh, sorry. Right, 1 or more falls with major injury since the prior assessment. You might say any fall should be counted, but that's not what they're counting. So when you look at data about nursing home, right, success, you might say, gee, the fall the fall data seems really low, and it's because they're operationalizing falls as a major injury-based fall, right? Depression symptoms last 14 days, last 7 days, and then pain, think about it. You might want to say, like, anyone who rates any pain, we want to count. But in this big statistic that is used by Centers for Medicare and Medicaid, it's only those who have moderate to severe pain within the last 5 days. So they're truncating pain, they're conceptualizing, they're operationalizing pain, and we need to know how they're measuring it so we can understand the data that we're reading and the summary statistics they're giving us. So now I'll give you an example from this study. We're going to go through the study by Bush et al. So let's think back. This is review, and I know you all know this, but the independent variable is kind of the driver. It's the one that's giving the effect that's causing the change, right? And it needs to precede or come before in time and temporal order before the dependent variable, and it has to have values. So your independent variable can't be 100% the same thing. It has to have different choices. So a typical independent variable might be a nominal level variable, but are you assigned to the treatment group or are you assigned to control, right? Which group are you assigned to? What's the name of the group? And that will impact or affect your outcome. And here's the study I alluded to where they looked at, and they were looking at basically people with depression if they would complete a series of training, right, sessions. So they looked at patients who were depressed, and they wanted to see who attended 20 or more sessions. They were completers. They used this CESD measure, and they used regression models to see if depressed mood predicted this program completion. So they're saying, were people who were depressed or not depressed, did that impact their level of completion of this program? And we'll talk about this. They controlled for other variables. As I've said many times, we live in the real world, like there's more than one variable causing an outcome. So we want to make sure the relationship here between depression and the outcome of, completing this program, that it's not related to any other thing. So we want to make sure that health isn't making the people complete or not complete the training. We want to make sure that it's not age, right? It's not race, it's not gender, it's not anything else that really is making the difference. We want to make sure that the difference is depression. We're isolating depression as the independent variable of interest. So here, depressed mood was the independent variable. And I'm going to see if I can find the CESD for you. Just give me 1 second. I can pull it up in many ways, but I'm going to just pull it up here. All right, CESD. Okay. So here's I'm going to stop sharing. I'm going to reshare. Okay. So if you see, I'm sorry. Yeah, let's do this. It's here. Okay. If we scroll up, you're going to see that the CESD, this depression scale, looks at many, many things, right? So look at this scale. This is how they're defining depression: being bothered, appetite changes, social isolation, I feel just as good as other people talking less, feeling lonely. So this is how the CESD is operationalizing depression. There are many other scales and measures we could use, but we always want to go back and see. And if we look, it's an ordinal level scale. It's saying rarely, sometimes, occasionally, or most of the time. So this is the scale they're looking at, and this is how they're calculating and assessing depression. You might have another measure or another scale, but we need to know what scale are they using. Go back here. Okay, just make sure this is, sorry, I want to pull it up one more time. So you see depression can be operationalized many ways. This is what they're using. They're using that scale. It has a number of scores that are ordinal. And at the end of the scale, there's a summary measure. And that measure indicates if the person is considered depressed or not based on that scale, right? Not based on other criteria. So just on that scale. The dependent variable, right? It's response to intervention. It's in this case, it could be completing the program, right? That was their dependent variable. Did depression affect individuals' completion of that program? Right? When you do treatment, does the treatment that you're giving someone, like a new drug, the independent variable, does it decrease anxiety based on a scale, like an anxiety measure? Right? Does that new drug decrease anxiety more than placebo or more than a traditional drug? And here we go for the Bush example, same thing. The program completion was the dependent variable. It's the outcome variable. Independent variable, is the person depressed? Was that level of depression? Did it impact people's completion of the program? And then let's go further. As I said, we know that people's completion of that program could have been from many other things. So maybe we might think, well, if somebody is in health and they have a health change, right? Their health becomes poor, or if they have low income, or if they have more education, they might be more likely to complete the program. I don't know. But there's all these other ifs, if questions. So we want to make sure that we address them. And we call these extraneous variables, so we control for them. We say, look, we know there's more to this relationship between depression level and completing a program. There's these 5 or 6 other variables that we think could be related, so we're going to control for them. We're going to put them in a statistical model and make sure that these other variables are not the real independent variable. And it's often demographic or other variables. So I'll show you in the I'm going to show you here and I'll go back. So here, of the 20 people who were completing that program, they were looking at depression. Does depression impact program completion? They looked at all of these other variables, health status, demographic variables, probably gender, race, age, class, education, etc., etc. They did find that when they looked at the other variables, gender was important, right? That when they looked at the relationship between gender and depression interacted, so that gender and depression were more impactful or had a bigger weight on the outcome for women than men. So they found by controlling for these variables that another important variable to consider, in addition to the independent variable of depression and dependent of program completion, was gender, right? And that gender varied. The relationship varied by gender. And it's not surprising because traditionally in the literature, women report depression more frequently, and it's more gender related. So it makes sense. So again, in the next session, we'll talk a little bit about internal, external reliability, validity, all those kind of things. I'll also make a quick video showing you the assignment and giving you some feedback on that. So just think, do I know level of measurement? What questions do I have? Do I understand independent, dependent? And this is what I wanted to show you. This is the idea of the relationships of variables. Do I understand this third variable, this spurious variable, this exogenous variable, this extraneous variable, meaning other? So I'll give you an example, and you don't have to worry about mediation or moderation, but I want you to think about just these third blue variables. So I'm studying immigration status and access to healthcare, and I find that there's a relationship in the US, right, based on those who have a certain status and those who do not. Let's say those who have a certain status have a better access to healthcare. What I didn't account for was insurance type. So the relationship is really immigration status is related to insurance type, which also affects healthcare. So this is an extraneous variable that we need to think about. Here, this is a traditional relationship, chronic pain and mood, right? If you have chronic pain as an independent variable, your dependent variable of mood is going to not be good, right? No one, pain is a teacher, but pain is not good. Right. So we want to look at gender because we do find that there's a gendered component, and this relationship between chronic pain and mood varies by gender. So just think, right? Do I understand independent, dependent? Do I understand extraneous variables? And do I know what level of measurement is? Do I get it? And can I give an example of each level of measurement?